So John, 15 years.
Wow.
15 years. It's weird
Isn't
to think
it?
about
It
it.
really does.
We did the first
The first
interviews
interview was here.
here because we didn't have any office space.
Yeah.
And we didn't have any money. When we started Pathways, the best way to start something is with people you know.
You know, I've always wanted to help people. As I say, substance abuse issues have always been a concern of mine. So when she asked me to come on board in 2008, I was leery because I'm like, this is brand new, and I've been over here at MHA. I'm doing well. It's been 7 years. And after some thought and prayer, I really decided to take a risk and come on over.
And just to think, I at first didn't think this was going to work, you know?
The experiment called
Yeah,
Housing First.
Housing First, you know?
So in Philadelphia, there was this population of folks that nothing was working for. The city came to me and said, we should look at doing a Housing First model in Philadelphia to serve this population. Can you write the HUD grant? Because we're going to need HUD subsidies for this. And then I looked in the program and I said, this is the craziest thing I've ever heard of in my life.
Chris was talking about Pathways was going to take people right off the street and put them in housing. And I was thinking, this is not going to work.
I came from the traditional system where people earned their right to have permanent housing. And then I looked at the model and I looked at the results they were getting in New York, and I read the literature, and I was really surprised by the outcomes, and I bought into it. The interesting thing with Housing First is it doesn't take a lot of time to get up and running. So, we started the interviews in September in the lobby of the Marriott. By October 26th, I think it was, we had found some space for our offices. We had hired staff. We had done outreach, built some relationships with people living on the street, and moved our first person into housing. So, 6-7 weeks from nothing, we had people living in housing. The walk down memory lane, we're headed to 4040 Market Street, which was really a great space.
There was only one team in the beginning, of course. So you had one team leader, one ATL, and then they had 6 or 7 other people that they finally brought on board to go out and engage these people on the street.
I had a couple friends who wound up working here really soon. They just kept talking about Pathways and, come meet people here at Pathways, and wound up coming and meeting Chris and telling her about some of the research that I was doing, and asked if I could volunteer at Pathways. That first job was basically I would get a list of names and intersections for people who might qualify for housing, and then I would go across the city every day and look for those folks. And we helped build Team 3 with that, and then some of the veteran teams.
When we were at 4040, our original contract was for 2 teams, and then we contracted with the Veterans Administration and had a 4th team, and that's when we outgrew the space. We're currently located at 5201 Old York Road, and we have the 4th floor and about half of the 3rd floor. So it's kind of been this gradual, as-needed expansion. And luckily, this building had the space to expand into.
We have 8 teams now, and so we have more people out there engaging people.
We follow a basic model, assertive community treatment, so they're ACT teams. That's essentially a one-stop shop for people with high needs.
And the idea is that there are medical rounds and there are treatment rounds. There's somebody at the table from each of those areas so that there really is integrated services.
Before it was a little more ragtag. One thing has definitely changed in these past 12 years is that it's a lot more professional, it's a lot more put together.
So we started Housing First University because people want to learn how to do what we do. It feels good that people recognize what we're doing and they want to get the same outcomes. And it feels good to know that we're helping people in other communities on the streets to get what they need.
We just recently started doing shared housing where we're bringing people out of recovery where they're sharing a house, where we got 3 bedrooms, 2 bedrooms. That's something we never did. We only did 1 bedrooms and efficiencies. And then recently we came up with something called temp units because we have a lot of people who are on the street who are apprehensive. But if you give them a temporary and say, listen, just try it. Here, I got this place I can take you for the night. Sit here tonight, see what you think. If you like it, then we can start looking for you another place.
So the Pathways mission, we provide homes, we restore health, we reclaim lives, right? Like that's the quick and dirty. But when you get into that, it means so much more, right?
Anyone who's in a situation where they're moving out of something emergency and into something permanent can come and literally shop the warehouse for furniture so that when they move into their new space, it really is home. We furnished about 300 households in the first year, which at that time I thought was a lot. This past year, we furnished over 1,400. Like everything else with us, things grow to meet the need. In this city, especially with almost 26% poverty level, a lot of people are very close to being that person on the street. And there were times in my childhood where I felt very close to being that person on the street. It's a bit of a different perspective when you can see yourself there.
We started with something that was kind of a wild idea to say we could do more to help people reclaim lives and live fuller. And then over the past 12 years, that's really grown in a way that's been extremely beneficial to the participants.